you very much. Well, it's a pleasure to join you today. We've really enjoyed our experience in Ukraine and continue to enjoy working with the team there. So we're going to present a little bit differently about some of the technology that we're working on in Ukraine and some of the work that we're doing to enhance and improve prosthetic care, both in Ukraine and beyond. So we're really looking at mobility at scale. How do we get people up and walking? How do we get them moving a little bit more quickly? And how do we perform better prosthetic care in many parts of the world where prosthetic care is limited? So I'd like to thank my collaborators on the project. There's many on there, but myself and Carol Kraus are here. Carol and I think Michael Gorski are both present in Kyiv. So we look forward to communicating and collaborating together. And I'm sitting here in my home in Houston, Texas. So it's a pleasure to talk with you today. So one of the compound challenges of global health is this concept that oftentimes disability, and especially sudden disability, like an amputation or loss of limb, oftentimes has this negative cycle, creating kind of vulnerable populations that have difficulty reintegrating, that lose loss of income, loss of function, and all of these things. And we've seen this all over the world, repeated over and over again, what we call this disability cycle.
Very sorry, we do not see the next slides here. May you move them? Try to change.
Yeah.
Now they do not change. Unfortunately.
Try one more time. We're using a different.
Hey, Jared.
Yeah.
See it through the editor, so it might be.
Just go ahead and share through the editor. That's fine.
It does stop through when you start to present. Stop sharing.
Thanks, Carol.
Yes.
So can you?
Work.
Okay, we'll leave it through the editor then. So this compound challenge with global health is this disability leads to poverty and vulnerability over time, and we see that individuals that have amputation or major limb loss or other rehabilitation conditions tend to get stuck in this cycle over time. And what we're finding is that it not only affects the individuals at the level, but it also tends to affect generations after that. So one of our goals is really to address this problem, which is access to prosthetic care is limited to about 10% of the world's population. And it's not just a problem in Ukraine, it's a problem everywhere in the world, that 90% of people do not have access to well-fitting, well-established prosthetic care. So there's a few fundamental challenges with that we begin to address, or that we start to address. And one of which is it's just plain time consuming. So traditional fabrication of prosthetic devices requires a highly specialized team. It requires large laboratories oftentimes. It's both labor and capital intensive. So we've just outlined a few steps that are required typically in a traditional manufacturing process of a transtibial or a below-knee amputation or below-knee prosthesis here. One of the things that we see all over the globe is this lack of qualified clinicians and technicians, which tends to exacerbate or to make worse this health disparity that exists. And this traditional approach to fabrication, to creation of prosthetic limbs, doesn't really begin to address those disparities, because the training is still required. The efforts that go along with that are still significant, and we just can't meet the demand from a case-by-case basis. Now, we've been fortunate to practice and to work with many different countries all over the globe through our Baylor Global Health Program. To begin to understand, to look at these disparities. Now, Ukraine's just a little bit different in that there's a much more advanced health system than other parts of the country, other parts of the world. But I think we still run into some of these disparities given the number of trained clinicians, as well as just access to care. And anytime you have a large influx of new individuals with amputation, those are difficult to address or to ramp up the training and the requirements to do that. So one of the things that we have looked at over the course of the last decade of research at Baylor College of Medicine is looking at the technology side of delivering prosthetic care more readily to the group of individuals that need it most anywhere in the world. So we looked at these four elements, specifically at technology development, how to educate and translate this technology to others. But as importantly, we look at structural mechanical validation of the materials and the tools that we're using,
Чутно.
as well as,
Пане Давид, так,
ensuring that the
second place,
clinical
да.
testing is done in a way
Товариство,
that's
ви це
consistent
чули, та? Це не
with
пожежна
our
тривога,
values
це ми отримали
and
сигнал
the need of
повітряної
the
тривоги
population that
про
we're working
загрозу
with.
балістики, тому будемо
It's a ballistic threat.
So this has been a multi-collaborative project.
Mr. Jared,
I
we're
think that the
sorry.
problem is probably well understood by the group in the audience. We know that since the full-scale
пан
invasion
Джаред не
of
хоче нас чути,
Ukraine,
так?
there's been a
We
significant gap
received air
in the
alert.
number of qualified
George.
individuals that are qualified to provide prosthetic care in the
Джордж
country.
працює, товариство.
We have we are asking you to move to the bomb shelter because there is a threat of ballistic